Hi friends, I am Dr. Anshul Bansal joining you on this Unacademy platform. As you know, in today's YouTube live session, we'll be discussing some NEET PG oriented MCQs question which are very important for this year's NEET PG. Okay, so it will be a marathon session. We'll discuss about 30-40 questions, very important. We have discussed them earlier also. They are the recall questions. Majority of them are the recall questions. We'll focus on the x-rays and the clinical based questions more. Okay, so I'm currently working as an orthopedic house surgeon in SMS Hospital Jaipur, and I have cracked the same NEET PG examination last year, that is in 2020 only. Okay, so let's start the today's session. And before starting today's session, I will just guide you briefly about our various subscription plans, the paid subscription plans which are available for the NEET PG at the Unacademy. And the first one is the plus subscription plan, in which you'll get access to all our live as well as recorded classes, our question banks, both of which are formulated by India's topmost educators for NEET PG. You can compete in live tests and quizzes, and also we'll allow you to sorry will allow you to log in with the same device on multiple devices, so that you can study on any device of your choice at any time. And also for the subscribers who will be subscribing for 12 months or more, we'll be providing them shortly with the printed notes, and you can use this code during your subscription to get extra 10% off. Now second one is the iconic subscription, and it is the best one, best not only on the Unacademy platform but on any digital platform across India. And apart from the things that I mentioned earlier in the plus subscription, in extra what you'll get the prep ladder and all of the prep ladder, including its QBanks, video lectures, rapid revisions, the grand test, the live test, everything you'll get. And on an academy platform, in extra you'll get well structured live batch wise classes, and we have formulated our course in such a manner so as to build your concepts about that subject or topic first, then going into its in-depth analysis. And also after every test, the iconic subscribers will get an individual assessment sheet for that test, and by that you can analyze yourself, you can identify the topics or the subjects in which you need to work harder. Okay, so you can apply for this iconic subscription using this code to get extra 10% off. Now special class are very important. They will give you extra edge over everybody else. And what is special in these special classes, the most important feature is that in this COVID time also you can get a live classroom like feel, where you can interact with your educator, you can ask your doubts there and there, you can participate in polls. Okay, you just need to raise a hand to ask any doubt. You will never miss a class because we'll constantly notify you, and you can also take the class anywhere anytime by just logging to your Unacademy application. And also we'll be providing with the digital lecture notes. You can use this code to get extra 10% off. Now keeping in mind the various sets of students who are preparing for different examinations, like some of you are preparing for your FMG, some for this year's NEET PG, or some for the next year's NEET PG. So keeping in mind the different pool or bunch of the students, we have started dedicated batches to these examinations also, and you can use this code during a subscription to get extra 10% off. And also for the NEET PG 2021, just 7 days are left, so we have started a 1 month revision package, which is personally speaking also the best, because here you will get everything that you need for the last 1 month. The last minute tips and tricks, the high yield MCQs, the high yield important topics or the subtopics, the recent advances or the recent updates, the images, clinical scenarios, x-rays, pathological slides, everything and anything that you need for the last 1 month is available in this package. So go for this package. Also the grand test and the live test and quizzes all are included, and you can avail this package by subscribing to this course, and you can use this code to get extra 10% off. And also for the students who will be subscribing for 12 months or more, we have running a limited time period offer in which you will get that subscription course of 2 months absolutely free. And for our MBBS students, we have started our 4-year subscription package in which we are giving a limited time period heavy discount, and after discount this package is available for iconic subscription for just 75,000 for the entire 4 years. So hurry up, please avail this offer, and you can use this code while subscribing to get extra 10% off. Now these are the rate list of a plus as well as our iconic subscription plans, and as you can see, the cost per month decreases significantly if you increase your duration of the subscription. So I will highly recommend you to increase the duration of the subscription. And also keeping in mind the coming next pattern, the MBBS students need to focus on the studies from the word go. So buy a subscription plan with longer duration of action, longer duration of months, and also remember कि एक प्लेटफॉर्म यू हैव टू चूज. एंड बिकॉज आप बार बार आपका सोर्स ऑफ इंफॉर्मेशन चेंज करते रहोगे तो यू विल हैव very difficulty in remembering the things. Okay, so don't change your source of information frequently. एक को पकड़ लो, and for that Unacademy is the best. So go for the subscription plans of Unacademy with longer duration. Okay, and you can use this code while subscribing to get extra 10% off. Okay, so let's start the today's session, and after reciting every question I'll give you 15 seconds and you can type your answer in the live chat box, or if you have any doubt regarding orthopedics for the NEET PG, you can also ask in the live chat box. Okay, so let's start today's session and let's crack NEET PG with Unacademy. Okay, so the first question is, a child with recent fever and with sclerotic rim in the upper end of the tibia, what is the diagnosis? Okay, here are your 15 seconds. Okay, so the answer for this question is 3 Brody's और ब्रोडीज एप्सिस एंड वाई. सबसे पहले स्क्लेरोटिक रिम दो जगह दिखती है, ऑस्टियोइड ऑस्टियोमा में भी एंड ब्रोडीज एप्सिस में, नॉट इन इंट्राकॉर्टिकल हिमेंजियोमा में. यस वो दिखता है, स्क्लेरोसिस इज देयर बट नॉट दैट प्रोमिनेंट इन दीज टू. सो अब इन दो में कंफ्यूजन है. सो इसको रूल आउट करने के लिए एग्जामिनर हैज गिवन यू अ वेरी वेरी इंपॉर्टेंट thing in the question, and that is history of fever. Okay, so if there is history of fever here, so the diagnosis goes towards infective pathology. The diagnosis goes towards the infective pathology, and that is Brody's abscess. Okay, see here you can see Brody's abscess. It is a atypical form of osteomyelitis, and इसमें क्या होता है, the infection resides in one area of the bone only because due to the mechanism of the bone is strong, yani ki the immunity power of the person is strong. So there will be a gelatinous collection. This is the gelatinous collection surrounded by a a zone of sclerosis or a rim of sclerosis. This is Brody's abscess, and the proximal tibia is the most common bone that is affected. The Staph aureus is the most common organism which causes this Brody's abscess, and most commonly it is in the metaphysis. And what is the treatment? The treatment is drainage, okay, followed by sending that to the culture and sensitivity and starting the antibiotics. And if the defect is large, yani there is very hollow part that is left, you can go for the bone cementing etc, but not initially. After some time when the infection जो है वो antibiotics coverage के बाद the infection has subsided. And what is the duration of antibiotics that you give antibiotics for 6 to 8 weeks, and it may be 2 to 3 weeks you have to give antibiotics in by intravenous route. Okay, so very important about the Brody's abscess. Okay, so this is a typical appearance of the Brody's abscess in the upper end of the tibia. Here you can see a gelatinous infective material surrounded by a rim of sclerosis. Okay, this is called as the reactive sclerosis. This is called as the reactive sclerosis. Osteoid osteoma, here you can see zone of sclerosis will be more, but it is a benign tumor with no history of fever. Okay, and in intracortical hemangioma, नाम से पता चल रहा है the cortex will be involved. Okay, and this is of humerus, so there will be multiloculated appearance with internal septas that can be seen especially in the MRI. So this is your intracortical hemangioma. And the chondromyxoid fibroma, it occurs in young adults, metaphyseal area, solitary, there is pain, there is no fever, and generally it occurs in the small bones. Okay, so here is the picture of the chondromyxoid fibroma. Now the next question is the most common joint involved in septic arthritis is. Here are your 15 seconds. Okay, so the answer for this question will be second, that is the knee joint. Knee joint is the most common joint, followed by the hip joint, and then the elbow and the shoulder joint. First the shoulder, then the elbow joint, then ankle, and then the sternoclavicular joint. So knee joint सबसे commonly involved हो जाता है. Why? Because knee joint is a superficial joint as compared to other. Okay, it is very superficial joint as compared to other, that is your knee joint. So इसमें the infection in the knee joint or the arthritis of the knee joint can occur due to various reasons. First is due to the hematogenous route directly into the joint, hematogenous या capillaries या arterioles venules के through the pathogen has entered the joint space, or due to direct invasion by a compound fracture or any penetrating wound into the joint, or it can come from infectious like cellulitis or abscess from the adjacent soft tissues, or even infection from the adjacent bone can migrate into the knee joint. That is the adjacent bone का किसी का osteomyelitis that can migrate into the knee joint, uh, forming the septic arthritis of the knee. And septic arthritis mein we have the typical pathognomic features of bone destruction, the joint destruction. Okay, there will be signs of acute inflammation, periosteal reaction, and the joint will get destructed. Now the next question is very important question. The question is, which of the following is incorrect? Here are your 15 seconds. Okay, so the incorrect statement about this is fourth, chemotherapy is the treatment of choice. इससे पहले we have to see what is the diagnosis, and कोई history नहीं दे रखी है, सिर्फ एक image दे रखी है, and इस image से ही you have to go for the diagnosis, and the diagnosis is your GCT. Very simple. हमेशा diagnosis बनाते time बहुत सिंपल जो कॉमन वेरी इंपॉर्टेंट डिजीजेज है उनका पहले डायग्नोसिस बनाना है, स्पेशली व्हेन द हिस्ट्री इज नॉट गिवन. ओके, अभी कॉन्ड्रोमिक्सॉइड में भी ऐसा ही पिक्चर कुछ कुछ देखा था, तो आप बोलोगे वो क्यों नहीं हो सकता. ओके, सो हिस्ट्री इज नॉट गिवन, जीसीटी इज योर मोस्ट लाइकली डायग्नोसिस. तो जीसीटी के क्लिनिकल फीचर्स क्या होते हैं इन रेडियोग्राफ. First we'll discuss the radiographical features. It is eccentric in origin, यानी center में नहीं, center से थोड़ा दूर होता है. Here you can see soap bubble appearance. Here you can also see the soap bubble appearance. Okay, tumor arise from the epiphyseal region. This statement is also somewhat not correct. Okay, because दी ट्यूमर, अगर आपके पास क्वेश्चन आता है कि जीसीटी अराइजेस फ्रॉम, सो जीसीटी अराइजेस फ्रॉम द मेटाफाइजियल रीजन, बट मोस्ट कॉमनली एट द टाइम ऑफ डायग्नोसिस ये एपिफाइसिस तक आ जाता है. सो मोस्ट कॉमन साइट in radiological or skygram image you'll have the most common site will be the epiphysis, but arise कहाँ से होता है, इट इज मेटाफाइजियल. तब ये भी रॉन्ग है, ये और ये भी रॉन्ग है, बट मोर रॉन्ग इज कीमोथेरेपी इज द ट्रीटमेंट ऑफ चॉइस. बिकॉज अगर आपसे कुछ भी नहीं दे रखा हो लाइक इन दिस क्वेश्चन, सो द ट्रीटमेंट ऑफ चॉइस विल बी द एक्सीजन ऑफ द ट्यूमर with reconstruction. Okay, chemotherapy is not done. So this is your GCT, the soap bubble appearance, and GCT में you will have the giant cells, multinucleated giant cells. Here you can see, तो इसलिए इसको osteoclastoma भी बोलते हैं, but it is a misnomer because it is not a tumor of osteoclast. Now treatment of GCT is very important and it depends on the area where it presents, and remember GCT have a high rate of recurrence. Okay, it is a locally aggressive tumor. So firstly functional bones को involve किया है, like bones around the knee joint or distal end of the radius. So here you have to do excision with reconstruction, and this reconstruction is done by grafting or other things, or the plasty and turnoplasty is used. Okay, and if the bone that is involved is non-functional like your distal ulna or the proximal fibula, so here only excision is can be done. Okay, and if it involves the vertebral column, then the treatment of choice will be your radiotherapy. And fourth is another thing, that is curettage, and after curettage treatment will have the highest chance of recurrence. Okay, so after curettage जो बचे हुए tumor cells है, to destruct them you go for the bone cementing, because bone cementing have a thermal effect. Or other things what you can do, use, you can also go for cryotherapy, etc. So this is the treatment. So treatment of choice will depend on the framing of the question or the clinical history of the question given. So read the question carefully. Now, next question is painful arc syndrome. In painful arc syndrome, pain is in. Here are your 15 seconds. We have discussed this in a previous question answer session also. So, sorry, the answer for this question is the mid abduction. So painful arc syndrome को याद रखने के लिए मैंने आपको बताया था, just remember 2 or 3 things. सबसे पहले it is also called as impingement syndrome or the supraspinatus syndrome, and this impingement is due to subacromial bursitis. Okay, so इससे आपके सब चीजें ऑलमोस्ट कवर हो गए. सुप्रास्पाइनेटस इन्वॉल्व है, सो it is an injury of rotator cuff muscles. Okay, so this is about the पेनफुल आर्क सिंड्रोम. इससे याद रखना है आपको, ठीक है. Now what are the rotator cuff muscles? Okay, rotator cuff muscles के अंदर there are 4 sets of muscles, and these are supraspinatus, infraspinatus, and supraspinatus, infraspinatus. एक और ऐसे आएगा, that is subscapularis, and the fourth one is your teres minor. Okay, the fourth one is your teres minor. These 4 muscles form your rotator cuff. Okay, they're very important. Now this mid abduction में जो pain हो रहा है sorry, this is your subacromial pain due to the painful arc syndrome between 60 to 120 degrees. Okay, now next question is attitude of limb in posterior hip dislocation is very easy but very important. Here are your 15 seconds. Okay, so answer for this question will be very easy. Second, that is flexion, adduction and internal rotation. कैसे याद रखोगे? See, कोई सा भी joint है, मान लो hip joint में if there is posterior dislocation, यानी ऐसे pressure आए from anterior to posterior, so obviously the femur head will be posteriorly, so the limb will point towards inner side in flexion, adduction and internal rotation. Okay, so it is easy. और anteriorly होगा यानी पीछे से किसी ने pressure दिया है, so the like this hip will open up, so it will be the opposite in anterior dislocation. So most common joint dislocation is your shoulder joint, and इसमें भी most common is your anterior, but most common in elbow or the hip is the posterior dislocation, and anterior may be subcoracoid is the most common type of dislocation in case of shoulder. Okay, now causes of hip dislocation posterior, उससे पहले types anterior and posterior होता है, and here you can see anterior, this is the typical posterior, this is the typical posterior. Here you can see flexion, internal rotation and adduction, and here if it is at the below the labrum or glenoid labrum or below the acetabulum but posteriorly like this, so there will be flexion at the knee also, and this is anterior dislocation. Here you can see extension and externally rotated and abducted, and similarly agar the dislocation is more inwards, okay, यानी बहुत massive dislocation है towards the ilium and the ischium, then your knee will be flexed but with hip externally rotated, abducted and extended. Okay, so posterior dislocation, and it is obviously ऐसे force लगेगा, so you can very easily correlate कि dashboard injury in road traffic accidents will lead to the posterior dislocation of the hip. Okay, now next question is part of scaphoid which is susceptible to avian or most susceptible to avian is. Here are your 15 seconds. ओके, वेरी इजी, वी हैव डिस्कस इट मैनी टाइम्स, और मैं बार बार आपको ये इसलिए करा रहा हूँ बिकॉज इट इज़ वेरी मस्ट नो थिंग एंड अ पोटेंशियल क्वेश्चन फॉर दिस ईयर्स नीट पीजी, एंड द आंसर इज द प्रॉक्सिमल वन थर्ड. रिमेंबर, स्केफॉइड के 3 पार्ट्स हो जाते हैं, प्रॉक्सिमल वन थर्ड, मिडल वन थर्ड एंड द डिस्टल वन थर्ड. Proximal one third is called as the pole, distal one third is called as the tubercle, and middle one third, or more importantly, the junction of the proximal one third and the middle one third is called as the waist. Okay, ये तो हो गए 3 parts of scaphoid. Now, the waist is the most common site of fracture, and the pole or the proximal one third is the most common site of avian. And even if the fracture is of the waist, the avian will be of the pole. Okay, so very important. So this proximal one third will be called as your watershed area of this scaphoid. ऐसे ही talus में कहाँ पर होता है? Talus में it is neck of the talus. Okay, talus mein this is the neck of the talus. Okay, very important, याद रखना है आपको. And other features of scaphoid, you all know scaphoid cast के बारे में, you all know scaphoid cast और Colles cast में क्या difference होता है. Scaphoid cast में first of all thumb को भी you cast, and it is in the radial deviation, whereas the Colles cast is only till the head of the metacarpals, and it is put on with palmar flexion and ulnar deviation, and it is put like a glass holding, and it is put in palmar flexion with radial deviation, this scaphoid cast. Okay, very important, याद रखना है आपको हमेशा. And here you can see, obviously the union rate will also decrease when you go from the distal to the proximal part. The union rate will also decrease, so readily unite कौन सा होगा? The distal or the tubercle वाला part will readily unite. Okay, so this is about scaphoid, very important. So scaphoid fracture, most common fracture of the carpal bone or most common wrist injury is your scaphoid bone fracture, and avascular necrosis is a very important and most common complication. There can be non-union or malunion also. And what is the mechanism? Due to fall or an outstretched hand. Tenderness will be in the anatomical snuff box or in the radial side of your hand. Okay, and इसके साथ में there can be scapholunate or perilunate dislocation. Okay, management is your rise followed by immobilization by the cast. Okay, and if the bone goes into non-union or malunion, or if it is displaced, you have to put a Herbert screw, or you have to go for the ORIF, that is open reduction and internal fixation. Okay, so very important is your scaphoid fracture. Now next question is, foot drop can occur due to all except. Here are your 15 seconds. Okay, so answer for this question is your femoral nerve. Foot drop जो होता है, foot drop is inability to dorsiflex. Okay, so foot drop में your foot will be dropped like this. So there is a gait which is called as the high stepping gait, which is seen in foot drop. There are various reasons of foot drops. शियाटिक नर्व की ब्रांच होती है कॉमन पेरोनियल नर्व, और उसकी ब्रांच होती है, ठीक है, deep fibula or the tibial nerve. So these are can cause the foot drop, but femoral nerve ki injury say there will be no foot drop. Okay, so the answer for this will be the femoral nerve. Okay, so deep fibular nerve anterior compartment को करती है. Okay, now another cause for foot drop is wearing tight fitting shoes for longer duration and chronically. Example in sky boots, जो skiing and all करते हैं, so it is also called as ski boot syndrome. Okay, now these are the different causes, कॉमन कॉजेज ऑफ फुट ड्रॉप. शियाटिका यानी शियाटिक नर्व से रिलेटेड कोई भी इंजरी हो, पेरोनियल नर्व ड्यू टू सेरिब्रोवास्कुलर एक्सीडेंट और स्ट्रोक, ड्यू टू ट्रांसवर्स माइलाइटिस इन दी सेक्रम पार्ट जहां से शियाटिक नर्व ओरिजिन होता है, और ड्यू टू मल्टीपल स्क्लेरोसिस ऑल्सो. Okay, here you can see this is just high stepping gait of the foot drop, and when the patient lift the knee of the affected leg and it takes the step, so the affected leg will move with high stepping gait like this. Okay, so this is your foot drop. Okay, now next is scissoring gait is seen in. These are very important one liners. Scissoring gait is seen in. So the answer for this question is 2, that is cerebral palsy. Cerebral palsy में you see a scissoring gait, तो नाम से ही पता चल रहा है कैची की तरह होंगे. So the knee will be joined टू, यानी दोनों नीज आपस में फ्लेक्स्ड होगी ड्यू टू spasticity of the hip abductors. Okay, it is due to basically due to spasticity of the hip adductors, sorry, not abductors, spasticity of the hip adductors with weakness of the abductors. So there will be excessive adduction of the leg in the swing, and there will be plantar flexion. Okay, there will be plantar flexion at the ankle and increased flexion at the knee joint. Typically यहाँ पे you can see in the image, this is your scissoring gait. So there will be crossing or touching of the knee or the distal thigh, and while walking the arm will go away from the body to maintain the balance. This is your scissoring gait. And high stepping gait we have already seen, कहाँ पे दिखेगा, foot drop के अंदर दिखता है. Now the next question is, a 30-year-old male with femur fracture was normal for 2 days. Suddenly he developed tachypnea, breathlessness, skin petechiae and confusion. Diagnosis is. Here are your 15 seconds. Okay, so very important and very easy. The answer is your fat embolism syndrome, and it is very common in fracture shaft of femur, because there is blood loss बहुत ज़्यादा, and it is the most common site of hematopoiesis. So fat embolism leading to the pulmonary damage or the pneumonitis can occur. So it develops after 2 days, and there will be tachypnea, breathlessness, petechiae and confusion. Okay, so इसको prevent करने के लिए what you do, most important thing to prevent this is immobilize the patient. Shaft of femur को थॉमस splint विथ बी के ट्रैक्शन लगा के यू हैव टू इमोबिलाइज, बार बार उसे बेड शिफ्टिंग और फॉर डिफरेंट इन्वेस्टिगेशंस के लिए यू डोंट have to shift the patient, you have to keep the patient immobilized, nebulize the patient regularly and give hydrocortisone injections. as a prophylactic measure, and if it has set in, you have to go for D dimer and FDP, and if they are elevated, or you can go for the CTNG of the pulmonary trunk or so, and you can give the low molecular weight heparin. But mainly preventive measures होते हैं, और एक बार it sets in, you have to immobilize the patient, properly give the nebulization and the oxygen to the patient, and wait and watch. Okay, this is your fat embolism syndrome. Now fat embolism syndrome को diagnosis करने के लिए you have टू क्राइटेरिया. फर्स्ट मेजर क्राइटेरिया, इनमें से कोई एक हो तो भी चलेगा, प्लस एनी फोर ऑफ द माइनर क्राइटेरिया, it will lead to the diagnosis of the fat embolism. Okay, so what are the major criteria? Petechial rashes, respiratory insufficiency, and the cerebral involvement. Okay, इसको याद रखना, because generally बच्चे इसमें confuse हो जाते हैं कि how the brain nervous system can be affected, but lungs affect हुए हैं, so there will be hypoxia leading to the cerebral involvement or the confusion, etc. So petechial rash, respiratory insufficiency, and cerebral involvement are the major criteria. Minor criteria में there will be tachycardia, fever, retinal changes like of petechiae, jaundice, renal signs of oliguria or anuria, thrombocytopenia, anemia, raised ESR, and in urine or in blood you can see fat microglobinemia. मैक्रोग्लोबिनीमिया, ग्लोबिनीमिया आ गया, यानी अपन अभी किसकी बात कर रहे हैं? ब्लड की बात कर रहे हैं. ग्लोबिन यूरिया होता, सो इट वॉज विल बी ऑफ यूरिन. Okay, now next question is, Bryant's traction is used for which fracture? Here are your 15 seconds. Bryant's fracture is used for fracture femur in children with less than 2 years of the age, and it is also known as gallows traction. Very important. So अगर मैं ये gallows traction देता, so gallows traction से you all would have guessed it, but its other name is the Bryant's traction. 2 साल से कम के बच्चों के फीमर फ्रैक्चर में you use it, but this is obsolete nowadays because due to high patient incompliance, because here you can see it, your buttocks should be off the bed and the legs are tied to a overhead ring like this. So obviously here you can see it is very cumbersome for the patient also, so it is rarely used nowadays. So it is gallows traction or Bryant's traction for children under 2 years of age, and maximum weight is of 12 kgs. And yaad rakhna important part, it is always applied bilaterally. Okay, it is always applied bilaterally, and hip should be above the ground. Hip should not touch the ground. Okay, this is your Bryant's or gallows traction. Now next question is, a 6-year-old boy presenting to the emergency with a painful limb, it reveals tenderness in the femoral triangle, and there is some limitation of the hip movements. X-ray was normal. What is the next step of management? Here are your 15 seconds. So the next step of management for this would be ESR or CRP. Why? Because सबसे पहला है, it is a 6-year-old boy, okay, with painful limb, tenderness, and limitation of movement, and X-ray is normal. So it all points towards something of an infective pathology again, or a soft tissue pathology, but infective pathology more. So the infective pathology के लिए you have to go for the acute inflammatory media, ESR, erythrocytic sedimentation rate, or C-reactive protein, and both of which are increased in the infective pathology. So the next step of management or here would be ESR or CRP. सीधे aspirate आप नहीं करोगे, because you have to first diagnose it. And USG, ठीक है, so USG for at the hip in 6-year old boy will not give you good results. And firstly, if X-ray is normal, you have to go for the blood routine investigation, especially the CRP, ESR, and your TLC counts. Okay, now clinical features जो होते हैं infective pathology of the bone के, it depends on the age of the patient. Like if it is newborn or infants, okay, so there will be more signs of septicemia rather than the joint pain. यानी local signs नहीं होंगे, septicemia के generalized signs होंगे. Like baby will be irritable, refuse to feed, there will be tachycardia, tachypnea, fever. Okay, the joints will be warm and tender, no movement. Okay, and the intravenous line जहाँ से ले रखी है और umbilical cord, they will be inflamed. Now in children, like in less than 10 years of the age, there will be acute pain in the single joint that is involved. Okay, systemic nahi, local pain zyada hoga. There will be pseudo paresis because the range of movement will be decreased, and there will be acute signs of inflammations like redness, warmth, tenderness. Okay, there will be fever, rapid pulse. Okay, now the skin, obviously there will be having the signs of acute inflammation, and movements will be restricted. Okay, and very rarely you can also find a source of infection nearby the affected joint. And in adults, most commonly superficial joints like knee के अंदर होगा, and the localized joint के सारे symptoms you will have. Okay, now there is one thing that is called as silent joint infection in the adults. And what is this? In rheumatoid arthritis, or the patients which are on corticosteroid therapy, or even in the diabetes mellitus patients, you can have joint infection, but the signs and symptoms like pain, tenderness will be very minimal. So these are called as the silent joint infections. Okay, कॉर्टिकोस्टेरॉइड थेरेपी पे, डायबिटीज मेलाइटिस के अंदर, एंड रूमेटॉइड आर्थराइटिस पेशेंट्स के अंदर. तो रिस्क फैक्टर्स वी हैव ऑलरेडी डिस्कस. आसपास से आ सकता है अल्सर्स या स्किन इन्फेक्शन से, डायरेक्ट हो सकता है ड्यू टू प्रीवियस इंजरीज और एनी प्रोस्थेसिस और रीसेंट सर्जरीज. ओके, और हेमाटोजिनस रूट से आ सकता है. ओके, now here you can see a typical knee joint inflammation, knee joint sepsis, arthritis की जैसा लगता है. You can see redness and the swelling, etc. Now if you find any acute swollen red painful joint with fever in OPD, first you analyze, you do the X-ray, you go for the CRP and ESR. If CRP is more than 20 and ESR is more than 20, then it is pointing towards the infective pathology, and then you go for the drainage or the joint puncture and sending it for the culture and sensitivity, and then starting the empirical antibiotics. And अगर ये सब नॉर्मल है यानी इन्फेक्टिव पैथोलॉजी नहीं है, so you have to monitor, repeat, you have to do the examinations. Okay, so this is your treatment protocol in any suspected joint infection or bone infection. Okay, so now the next question. The next question is, a 50-year-old male had accident and presented with internal rotation, adduction and flexion of the hip. What is the diagnosis? Very easy, we have discussed it just now. Okay, ये क्वेश्चन एक तरीके से रिपीट ही है. So what is the answer? The answer for this is your posterior hip dislocation. Here you can see posterior hip dislocation. Now next question, jersey finger is due to. Here are your 15 seconds. Jersey finger is due to. So the answer is jersey finger is due to injury or avulsion of the flexor digitorum profundus. And कैसे याद रखनी है? सबसे पहले आपको मैंने इसको याद रखने का तरीका बताया. You have to remember mallet finger. And mallet finger में there is flexion of the DIP, distal interphalangeal joint. So there is flexion. So obviously flexion होगा. So the extensor tendons में there is injury, so it is mallet finger. And इसका उल्टा होगा jersey finger, where you will not be able to flex due to the avulsion injury of the flexor digitorum profundus. And कहाँ पे? Its area of its insertion पे. Okay, this is your flexor digitorum profundus की injury से jersey finger. Here you can see this is your jersey finger, unable to flex it. Now next question. Sunburst on X-ray is seen in all except. Here are your 15 seconds. Okay, so firstly you have to identify कि sunburst on X-ray का मतलब ये क्या पूछना चाहता है. It is trying to ask you about the periosteal reaction. Okay, periosteal reaction. So typically this sunburst or the sun ray is of seen in osteosarcoma, but periosteal reaction is also seen in many other conditions like chronic osteomyelitis, the Ewing sarcoma. Okay, and so many other conditions. So इसमें होगा, इसमें होगा, इसमें होगा. Hemangioma में there is no periosteal reaction. Remember, in GCT also there is no periosteal reaction. Okay, so the answer for this question will be hemangioma. और अगर इसी में GCT आ जाता ना, so it would have been a somewhat difficult question, क्योंकि बच्चे दूसरे लॉजिक लगा के कंफ्यूज होते. hemangioma आने से it has become a easy question, but if the option was of GCT it would have been a moderate question. Okay, so the answer is hemangioma. And sunburst appearance is due to periosteal reaction, that is the subperiosteal new bone formation. And the firstly ये start कैसे होता है? Radiographically you will see the formation of new bone at the subperiosteum, and you will see the formation of the Codman's triangle. Okay, that is triangular elevation, and it is most commonly seen in tumors, basically the malignant tumors of osteosarcoma or Ewing sarcoma. It is a form of periosteal reaction. This is a typical osteosarcoma ka skygraph. Here you can see a intense periosteal reaction which has breached the cortex and migrated to the soft tissues. It is a osteosarcoma, and this is a typical sun ray appearance. Okay, Ewing sarcoma में क्या होगा? There is periosteal reaction, there will be Codman's triangle, but the periosteal reaction will be regular, unlike osteosarcoma में जहाँ पे irregular थी, regular and in layers, giving a onion peel appearance. Okay, and chronic osteomyelitis में क्या होगा? Osteomyelitis में भी you will have the Periosteal reaction will be regular and in layers, but other features of cloaca, involucrum, and the sequestrum you'll see alongside it. So sequestrum क्या होता है? नेक्रोटिक बोन, और इस नेक्रोटिक बोन को बाहर निकलने के लिए एक पैसेज या एक साइनस या पस को बाहर निकलने के लिए एक पैसेज प्रोवाइड करता है, एंड दैट इज कॉल्ड एज द क्लोएका. And the involucrum is the new bone or the periosteal new bones that formation that occurs. Okay, so this is a typical sunburst, sorry, this is a typical sunburst appearance of the osteosarcoma. And lamellated or onion skin in the Ewing sarcoma, here you can see, here you can see lamellated type. Okay, this is about the periosteal reaction. Now next question is complete undisplaced fracture of femoral neck is. Here are your 15 seconds. Okay, so the answer for this question will be second, that is Gardens type 2. So सबसे पहले you have three types of classification for neck of femur. First is the Powell's classification based on the angle. Okay, Powell's angle के basis पे you have the Powell's classification. Okay, it is of three types. Second is your Gardens classification, which is this. It depends on the fracture. It is of four types. And the third is about the anatomical location of the fracture, or like transcervical, basicervical, subcapital. It is three types. So यहाँ पे जो बात हो रही है, it is about Gardens classification. And Gardens classification में you have four types of fracture stages. First, there it is called as the impacted fracture, जहाँ पे it will be a incomplete fracture with no displacement. Second will be complete with no displacement. It will be complete with displacement very less, यानी दोनों fracture ends में there will be some continuity. And fourth में there will be, it will be complete and highly displaced fracture, जिसमें the head and the rest of the femur में कोई contact नहीं होगा. So this is your Gardens type 4. Okay, here you can see this is your Gardens type 4, all the four types of the Gardens fracture. Okay, so the एक बात जो आपको typically याद रखनी है about neck of femur में, that neck of femur में the symptoms will be less as compared to the IT femur, but prognosis is poor because it almost always goes into non-union, whereas IT femur will never go into the non-union. So treatment of choice is your surgery. ओके, एवरी टाइम नेक ऑफ फीमर में चाहे कोई सा भी एज ग्रुप हो, कैसा भी प्रेजेंटेशन हो, आपसे कभी भी पूछे व्हाट इज द ट्रीटमेंट ऑफ चॉइस, यू हैव टू टेल सर्जरी इज द ट्रीटमेंट ऑफ चॉइस. इफ इट इज डिस्प्लेस थोड़ा सा भी, है ना, डिस्प्लेस होते ही यू हैव टू गो फॉर द सर्जरी. नॉट इन द गार्डन्स टाइप 1, ऑब्वियसली गार्डन्स टाइप 1 इज इनकम्प्लीट, वो एक्सरे में दिखता भी नहीं है. ओके, so next question is test for injury of anterior cruciate ligament is. Okay, here are your 15 seconds, here are your 15 seconds. So the answer for this question is all of the above four. Very important लेकिन बहुत इजी है, सबने ऑल ऑफ द अबव ही मार्क करेंगे इसमें, बट द क्वेश्चन कैन बी फ्रेम्ड इन मैनी अदर वेज। तो सबसे पहले टू you have to have knowledge about all these tests. So सबसे पहले we'll study about the normal anatomy of the knee joint के ligaments. So as you know, first of all, cruciate ligament होते हैं क्रॉस जैसे में, there are two anterior and the posterior cruciate ligaments. So anterior of the tibial spine and posterior of the फीमर के इंटरकॉन्डाइलर वाले एरिया पे, एंड ऑपोजिट पोस्टीरियर विल बी, सो ये 3D के अंदर ये क्रॉस करेंगे। ऑन द मीडियल एंड द लेटरल साइड यू विल हैव द लेटरल कोलेटरल एंड द मीडियल कोलेटरल लिगामेंट। ओके, एंड यहाँ पे जो गद्दे जैसी चीजें हैं, these gaddas are your menisci, medial and the lateral menisci, remember। and आपको एक चीज जो सबसे important है नी जॉइंट पे वो याद रखनी है, medial collateral ligament, medial menisci and ACL, ये तीनों की इंजरी are correlated with each other। okay, and it is called as the terrible triad of knee, or the O'Donoghue triads, or the O'Donoghue triad। okay, if these three, ये generally rugby players and all के अंदर होता है। and what is terrible triad of elbow? terrible triad of elbow में you will have elbow dislocation with fracture of the head of the radius with fracture of the coronoid process on ulna। okay, now there are four classical symptoms of ACL is torn। और क्या होगा, ACL क्या होगा, एंटीरियर क्रूशिएट लिगामेंट से, तो इट प्रिवेंट्स द एंटीरियर डिस्प्लेसमेंट ऑफ द टिबिया। सो एंटीरियर डिस्प्लेसमेंट को प्रिवेंट करता है। सो द सिम्टम्स विल बी, इफ इट इज टॉर्न ना, यू विल हैव अ पॉप साउंड और सम abnormal sound from the knee during the injury। okay, and after the injury or at the time of injury you can see कि have a feeling of knee giving away, like knee में वो compactness नहीं रहेगी, because the tibia can be dislocated anteriorly very easily, and immediately there will be very intense swelling। तो इसका जो ट्रीटमेंट होता है, ट्रीटमेंट डिपेंड्स ऑन द परसेंटेज ऑफ द इंजरी, है ना, कि कितने परसेंटेज ऑफ द फाइबर्स आर इंजर्ड। मान लो कंप्लीट टीयर है, 100% इंजरी है, सो फर्स्ट मोड ऑफ मैनेजमेंट विल बी राइस, रेस्ट, immobilization, okay, etc. the rice therapy which we use, okay, it will be used, and with immobilization by a slab or cast or the brace, with limb elevation for at least 7 days or 1 week, and after the swelling subsides in 7 days or 10 days, then you go for the surgery. Immediate surgery is not indicated, and surgery is arthroscopy। okay, what is the surgery used? The surgery used is the arthroscopy, so very important। now we'll come to the टेस्ट। तो सबसे इम्पोर्टेंटली तो आपको बेसिकली नेम याद रखने हैं कि किस में कौन सा टेस्ट यूज होता है। तो इन ACL फर्स्ट ऑफ ऑल यू विल हैव द डायल टेस्ट। ठीक है, यू विल हैव द डायल टेस्ट, देन द पिवट शिफ्ट और ऑल्सो कॉल्ड एज द मैकिन्टोश टेस्ट। okay, आपको obviously in my lectures I have taught you in detail about these every test, but अभी नीट पीजी की तैयारी कर रहे हैं, only 7 days are left, so just remember the name कि कौन कौन से टेस्ट है। मैकिन्टोश और पिवट शिफ्ट टेस्ट, the dial test and the drop back test or the good phrase test। okay, drop back test or the good phrase test। now next question, A man 26 years old having pain with daily stiffness of spine for 35 minutes with reduced chest movements. Which test is used? It is a repeat question. We have discussed it like yesterday. No, not yesterday. 1 or 2 days back in YouTube live. So here are your 15 seconds. Very important and very good question. Okay, so सबसे पहले you have to form the diagnosis. Man, young adult, 26 years of age, pain and stiffness of the spine with reduced chest movements. ये सब diagnosis बना रहा है towards ankylosing spondylitis. Okay, and I have told you multiple times कि ये याद वर्ड आते ही आपको दो चीजें दिमाग में आनी चाहिए, and these are first is HLA-B27 positive होता है ये, and second is the bamboo spine. Okay, there is ankylosis, and first joint that is involved is your sacroiliac joint, and it is a systemic disease, autoimmune disease, and there can be reactive arthritis, most commonly of the knee, urethritis, iridocyclitis, etc. There is a typical bamboo spine, और इनको टेस्ट करने के लिए you have different types of tests like the pump handle test, Faber's test, Fletcher test, but Ober's test is not for the ankylosing spondylitis. So the answer for this question will be the Ober's test. Okay, so Fletcher test जो होता है, it is for the cervical spine ankylosing spondylitis. Image देखते ही you will understand कि normally if you stand straight against a wall with back on your wall and your heel touching the wall, you can touch the occiput of your head without moving or extending your chin, but it is not possible if you have ankylosing spondylitis involving the cervical spine. This is your, sorry, Fletcher test. Okay, Gansel's test and the pump handle test both are used to elucidate involvement of sacroiliac joint in एनकाइलोजिंग स्पॉन्डिलाइटिस. इमेजेस आर सेल्फ एक्सप्लेनेटरी, इससे ज़्यादा कुछ नहीं करना. गैंसल्स टेस्ट इज़ वेरी वेरी इंपॉर्टेंट, इसको याद रखना. इसकी एक खास बात होती है, तो खास बात इज जो अफेक्टेड और दो टेस्टिंग लिम्ब होता है दैट इज आउटसाइड द ट्रॉली, that part of the hip is outside the trolley or the table or the bed. Okay, hanging outside it. It is your Gansel's test, and Faber's test or Patrick test is also for the hip involvement or the sacroiliac joint involvement in ankylosing spondylitis. Now Ober's test. So Ober's test किस में use होता है? It is used to detect any inflammation of tensor fascia lata or the iliotibial tract. Okay, and if the knee is adducted, then it is positive after this maneuver with leg flexed at 90 degree and the examiner holding the distal part of the leg and stabilizing the hip with pressure on GT. अगर ये सब करते हैं, knee gets adducted, it means it is positive Ober's test. Okay, now next question. Next question is, which is the strongest ligament in the body? A very important one liner. Here are your 15 seconds. Okay, so the strongest ligament in the body is your Iliofemoral ligament. Okay, iliofemoral ligament is the strongest ligament in of the body. इतना सा ही आपको याद रखना है. Okay, now the next question, repeat question but very important question, is your true about osteoclast is all except. Here are your 15 seconds. Okay, so it is derived from monocyte. Yes. Phagocytosis of foreign bodies करेगा. Yes. Resorption करेगा. Phagocytosis करेगा because it is a multinucleated giant cell. Resorption करेगा. Stimulated by PTH? No. PTH do bone resorption? Yes. Primary cell or the major cell doing bone resorption is your osteoclast. But PTH directly affects or stimulates the osteoclast. This is wrong. Okay, very important mechanism is that PTH will have its receptors or will stimulate or will bind to osteoblast. Now the osteoblast will stimulate the osteoclast, leading to osteoclastogenesis, which will cause the bone resorption. And this osteoclasts are stimulated by osteoblast through the rank pathway. Okay, osteoblast rank ligand निकालते हैं, and these rank ligand binds to the rank which increases the osteoclast. So इस bone resorption को in check रखने के लिए भी there is a competitive inhibitor of this rank ligand which binds to the rank ligand so as to keep this resorption in check. Okay, and it determines the bone mass in normal and disease state. The bone mass को maintain करने के लिए you have this competitive inhibitor which is released from the osteoblast only, and it is called as OPG, that is your osteoprotegerin. Okay, OPG or the osteoprotegerin. Okay, here you can see myeloid progenitor होता है, monocyte से होता है. So it differentiate into the osteoclasts. Now the parathormone have its receptor on the osteoblasts. Okay, so it will bind through the osteoblast. Here is the rank ligand, you can see. Okay, the osteoblast rank ligand. So it will increase the osteolysis by stimulating the osteoclast, and its competitive inhibitor is OPG, osteoprotegerin. Okay, and it एक ये तो हो गया competitive inhibitor, और एक होता है feedback inhibition through CMA4D. Okay, now the next question is a 12-year-old child developed pain in lower leg after trivial injury. The diagnosis is, here are your 15 seconds. So the answer is obviously pathological fracture. तो ये तो traumatic fracture तो है ही नहीं. Now third is due to osteosarcoma. ये भी नहीं है because osteosarcoma में sun ray appearance and other टाइप का आपको रेडियोलॉजिकल फीचर्स मिलेंगे, that you all know very well. Sun ray appearance, periosteal reaction you will see in the soft tissue. Okay, so now दो ऑप्शंस रह गए, दैट इज पैथोलॉजिकल फ्रैक्चर ड्यू टू नॉन ऑसिफाइंग फाइब्रोमा और ड्यू टू एन्यूरिज्मल सिस्ट। ओके, सो अगर आप हिस्ट्री ढंग से पढ़ोगे, 12-year-old चाइल्ड विथ सच टाइप ऑफ, इसमें तीन चीजें देखनी है। फर्स्ट इज एज एंड सेक्स ऑफ द पेशेंट, द लोकेशन ऑफ द lesion and the x-ray finding, and इन सारी चीजें से you will have the perfect diagnosis of pathological fracture due to non ossifying fibroma, NOF भी बोलते हैं। ओके, नेक ऑफ फीमर नहीं है ये, NOF नॉन ऑसिफाइंग फाइब्रोमा है। एंड रिमेंबर दिस नॉन ऑसिफाइंग फाइब्रोमा लेटर लीड्स टू ऑस्टियोकॉन्ड्रोमा, which is the commonest primary benign tumor of bone. Okay, so non ossifying fibroma ही बाद में जाके osteochondroma बनाता है। तो अब aneurysmal bone cyst क्यों नहीं है? सबसे पहले aneurysmal bone cyst distal tibia वाले पार्ट में is rare. Okay, aneurysmal bone cyst is rare and there will be more expansile cortex with more लाइटिक और मोर सिस्टिक टाइप ऑफ लीजन। एंड यहाँ पे अगर आप ढंग से देखोगे तो सिस्टिक नहीं है, इट इज मल्टी लोकुलेटेड बट मोर सिस्टिक की जगह इट इज मोर ऑफ द ऑसिफाइंग टाइप ऑफ लीजन। ओके, सो दीज आर दी नॉन ऑसिफाइंग फाइब्रोमास। ओके, वी हैव सीन मल्टी लोकुलेटेड लीजन होगा। ओके, मल्टी लोकुलेटेड लीजन होगा with a sclerotic rim, there it will be present eccentrically in the metaphyseal area. Okay, and there is no periosteal reaction or cortical breach or breach into the soft tissue mass. Okay, very important, here you can see a typical non-ossifying fibroma. Okay, osteosarcoma में here you can see three pattern, lytic, sclerotic, mix, सब में there is intense periosteal reaction। and अब आते हैं अपन इसका डिफरेंशियल डायग्नोसिस जो सबसे इंपॉर्टेंट है, दैट इज योर एन्यूरिज्मल बोन सिस्ट। फर्स्ट ऑफ ऑल इट इज आल्सो इसेंट्रिक, मेटा डायफाइजियल लोकेशन, थिन स्क्लेरोटिक मार्जिन। ओके, बट ये वहां पे क्यों नहीं है? फर्स्ट ड्यू टू इट्स एज, इट इज मोर कॉमन इन और छोटा बच्चा एंड नॉट कॉमन इन द डिस्टल tibia. Okay, and it will be, here you can see more lytic टाइप का लीजन है and there is less sclerosis or there is less new bone formation या absent new bone formation. Okay, so it will be a eccentric lytic lesion. Okay, now next question is a one liner, important one liner is Tom Smith septic arthritis is. Here are your 15 seconds. ओके, सो द आंसर इज सेप्टिक आर्थराइटिस ऑफ इन्फेंसी को आप क्या बोलते हो? सेप्टिक आर्थराइटिस ऑफ इन्फेंसी इज कॉल्ड एज द टॉम स्मिथ सेप्टिक आर्थराइटिस। एम्स इन लास्ट टू लास्ट और उससे पहले वाले एम्स में आया था ये क्वेश्चन, टॉम स्मिथ सेप्टिक आर्थराइटिस इज। ओके, ऑब्वियसली इट इज seen in infants and most commonly Tom Smith septic arthritis is of hip, acute onset with rapid abscess formation and it automatically burst। अगर लेकिन ये automatically burst हो जाता है तो it will lead to a sinus tract formation और उससे पहले you have diagnosed it, so you have to go for the immediate incision and drainage। सारे प्लेन से सारा पस निकालना है, उसको कल्चर सेंसिटिविटी एंड अदर एग्जामिनेशंस के लिए भेजना है एंड यू हैव टू स्टार्ट द एम्पेरिकल आईवी एंटीबायोटिक्स एंड देन change it according to the culture and sensitivity. Okay, and here the telescopy test जो बच्चों में अपन करते हैं for the hip, telescopy test will be positive and it, इसकी खास बात क्या है? It will resemble Radiologically, it will resemble with the CDH, congenital dislocation of the hip. ओके, so यही इसके काम की बातें हैं जो मैंने आपको सब बता दी. Here you can see very easily appreciable ये जॉइंट का पूरा डिस्ट्रक्शन हो गया है, एंड इट इज अ वेरी पुअर प्रोग्नोसिस वाली डिजीज, बिकॉज बच्चों में इन्फेंसी में ही इफ द जॉइंट डिस्ट्रक्शन टेक्स प्लेस, so the development of that limb is hampered greatly. Okay, so this is Tom Smith arthritis. Now next question is, fallen fragment sign is seen in, here are your 15 seconds. Fallen fragment sign is seen in. So the answer for this question is your simple bone cyst, or also called as the unicameral bone cyst. उसमें आपको क्या दिखता है, उसमें you see the fallen fragment sign. Here you can see in the unicameral bone cyst or simple bone cyst, there is a small piece of bone like this which settles on the dependent portion of the cyst, and it is due to a pathological fracture. Okay, here you can see pathological fracture है and एक bone piece इसके dependent part में आ गया. So this is your fallen fragment sign, very important. Okay, and it is a pathognomic feature for simple or unicameral bone cyst, very important. Okay, and it is also reported in eosinophilic granuloma but not its pathognomic feature. Okay, so आपको fallen fragment sign simple या unicameral bone cyst के लिए याद रखना है. Okay, now next question. You are posted as an intern in casualty. Which among the following patients with fracture will be your first priority to call ortho postgraduate and inform? Here are your 15 seconds. It is also a repeat. We have discussed this question previously, but it is important. That's why I have added this. So here are your 15 seconds. Okay, so the answer for this question is patient's finger is blackening, because I've told you again and again that कोई भी fracture patients आता है. चलो first of all कोई भी trauma patient आता है, any patient of trauma, मान लो car accident और RTA. First of all orthopedic side से you have to, if you are sitting in the casualty, you have to rule out the brains injury or the head injury, the chest injury and the abdominal injury. ओके, ये 3 इंजरीज आपको सबसे पहले रूल आउट करनी है. एंड फ्रॉम द ऑर्थो साइड you have to do 2 important x-rays. First is your chest x-ray and second is your x-ray of the pelvis. ओके, यहाँ ये आपको कराने ही कराने हैं इन एवरी केस ऑफ ट्रॉमा, मल्टीपल ट्रॉमा. ये 2 एक्सरेज इंपॉर्टेंट है. एंड व्हाट आर द टेस्ट यू डू, वी हैव डिस्कस देम. स्ट्रेट लेग रेजिंग टेस्ट SLR, pelvic compression test, chest compression test, clavicle test. You have to check the active toe movement and the active finger movement, and you have to check the peripheral vessels like DPA and PTA, dorsalis pedis and posterior tibial artery for lower limb, and ulnar artery and radial artery for the upper limb. तो कोई भी फ्रैक्चर हो गया है तो सबसे पहले आपको राइस थेरेपी अप्लाई करनी है. Okay, then you have to check its vessels and nerves. ये सबसे इम्पोर्टेंट है. कोई भी फ्रैक्चर आए आपके पास, फर्स्ट ऑफ ऑल you have to check its nerves and vessels. It is the first and the most important thing that any ortho PG or any ऑर्थोपेडिशियन जो ट्रॉमा में बैठा है उसके पास कोई भी केस आता है, ये आपको करना ही करना है, भले ही फ्रैक्चर इंट्रा आर्टिकुलर हो, कितना ही ओपन हो, कितना ही कंपाउंड हो. Firstly, you have to check the nerves and vessels, and also remember जितना ज़्यादा fracture open compound होगा या lacerated wound जितना बड़ा होगा, there are more chances of the injury to the nerves or the vessels. So very important, please remember this. Okay, now second question, sorry, next question. In rheumatoid arthritis, which type of cells are predominantly seen? Here are your 15 seconds. Okay, so the answer for this question are predominantly there will be macrophages. Okay, macrophages and predominantly दो होंगे, macrophages and fibroblasts, because we know that rheumatoid arthritis जो होता है, it affects the synovium or the synovial membrane, and there is hypertrophy leading to the pannus formation, and this pannus formation will destruct the joint. Whereas in osteoarthritis, major pathology lies in the cartilage of the joint or the articular cartilage, leading to the destruction or the decreased joint space, leading to the destruction of the joint. Okay, ये बेसिक पैथोलॉजी के अंदर जो डिफरेंस होता है दोनों में वो याद होना चाहिए. अदर थिंग्स यू नो कि ऑस्टियोआर्थराइटिस प्राइमरी सेकेंडरी दो तरह का होता है. ओके, primary is natural in old age, and secondary osteoarthritis is due to any old fracture or other pathology, etc. So it is relatively in a younger age, and it is rapid and it is slow onset. Rheumatoid arthritis is an autoimmune systemic condition, so it will also be in a young age and predominantly in the females. Okay, there will be morning stiffness दोनों के अंदर, but morning stiffness in rheumatoid arthritis will be prolonged as compared to the osteoarthritis, and बहुत important is the involvement of the joint. In rheumatoid arthritis, most commonly involved joint is your metacarpophalangeal joint, then your PIP or wrist, etc. But ये ध्यान रखना, rheumatoid arthritis will never involve your distal interphalangeal joint. Okay, but osteoarthritis will involve the distal interphalangeal joint and the big joints like the knee, elbow, etc. Very important. Okay, so synovial lining or intimal lining को affect करेगा, so there will be hypertrophy, and the primary population will be of the fibroblasts and the macrophages. Okay, very important. Osteoarthritis, rheumatoid arthritis, ankylosing spondylitis, ये तीन आपको याद रखने ही रखने हैं for the examination. And osteomyelitis chronic and other types like Tom Smith या one liners Brody's or the Gary's osteomyelitis, इस टाइप के जो different osteomyelitis होते हैं वो आपको याद रखना है. And not in detail about this, just you should have this much knowledge कि you can make the diagnosis. Okay, that's it. Now next question. A patient has history of RTA, road traffic accident 2 years back. At the same site he developed pain and swelling. X-ray shows the following features. What will be the diagnosis? Okay, so here are your 15 seconds. सो बहुत अच्छा क्वेश्चन है एंड इट इज कंफ्यूजिंग जस्ट बिकॉज ऑफ वन थिंग एंड दैट वन थिंग इज इसमें जो एक्सरे है इट इज नॉट क्लियर। ओके, मतलब टिपिकल फाइंडिंग जो होती है वो आपको किसी की भी नहीं है। तो नाउ वील सी अबाउट ईच एंड ऑप्शन एक एक करके। फर्स्ट ऑफ ऑल, ऑस्टियोजेनिक सार्कोमा एंड इविंग सार्कोमा बोथ आर द ट्यूमर वाले लीजन्स एंड इनके टिपिकल लीजन होंगे ऑस्टियोसार्कोमा सन रे अपीयरेंस, इविंग सार्कोमा में यू विल हैव द अनियन पील एंड more of a lytic type of lesion. So Ewing sarcoma, osteosarcoma ये दोनों ही नहीं है। ओके, नाउ मल्टीपल माइलोमा नहीं बचा, chronic osteomyelitis and this is your answer and also RTA है। so there are chances of injury to the compound or open injury, so it can lead to osteomyelitis. So the answer is osteomyelitis and also here you can see that typical osteomyelitis के three features होते हैं। First is the sequestrum, that is your necrosis of the bone, then the involucrum, that is your new bone formation, and this necrotic bone sequestrum or the pus is drained by cloaca which forms the sinus. So isme you can see here you can see sinus and there is here you can also see the periosteal reaction of the new bone formation. So the answer for this question will be chronic osteomyelitis. Okay, now इसमें भी there is a special type called as Gary's sclerosing osteomyelitis which is a chronic non-suppurative osteomyelitis, यानी pus drainage नहीं होगा। So इस वजह से ही here you can see there is more sclerosis, so it is a उसमें भी the exact diagnosis for this is the Gary's sclerosing osteomyelitis. There will be mild inflammation and there will be subperiosteal bone deposition. Okay, and symptoms are very mild. There will be subperiosteal or periosteal proliferation. Okay, onion skin appearance jaisa. So this is Gary's sclerosing osteomyelitis. Okay, we have seen here you can see sinus cloaca, new bone formation involucrum and the necrotic bone जो lytic lesion type का लगेगा, that is your sequestrum. Okay, now next question is what is meant by perilunate dislocations? Here are your 15 seconds. So the answer for this question, perilunate dislocation, the answer is C, that is lunate is in alignment and capitate alone is out of plane. Now ऐसे याद रखो, there are two types of dislocations, lunate and perilunate. नाम से ही पता चल रहा है, द ल्यूनेट डिसलोकेशन में द ल्यूनेट विल बी डिसलोकेटेड एंड रेस्ट ऑल विल बी in normal alignment, and in perilunate the other carpals will be dislocated and majorly कौन सा, the capitate. Now see what happens here is this is your lateral view में this is your distal end of the radius, उसके ऊपर you have the lunate and उससे ऊपर you have the capitate. Okay, these three are in line. Now in lunate dislocation other all things will be in line, only this will be displaced, so this is called as the lunate dislocation, and if this is displaced then it is called as the perilunate dislocation. दोनों में से कौन सा common होता है? The perilunate is more common. Okay, so perilunate dislocation is the dorsal or the posterior dislocation of the capitate. Here you can see ये तीनों एक लाइन में है, but in perilunate dislocation this capitate will be dislocated and most commonly कहाँ पे, dorsally or posteriorly. Okay, here you can see mechanism will be fall on an outstretched hand, tenderness, इसी जगह पे you will have the tenderness, and associated injury will be, most commonly associated injury will be your carpal fracture, that too of the scaphoid. Okay, so this, and it is have a it have a special type of splint called as the sugar tongue splint. So इसको आपको closely reduce करके by the pressure you have to immobilize it. Okay, so this is your perilunate dislocation. This is your perilunate dislocation. Okay, so lower, we have studied lower end of the radius, scaphoid and capitate are in alignment and lunate alone out of the plane. So the perilunate dislocation में कौन सा लिगामेंट की इंजरी होगी, दिस इज इंपॉर्टेंट, इट इज द रेडियो स्कैफो कैपिटेट लिगामेंट. कौन सा, रेडियो स्कैफो कैपिटेट लिगामेंट. ओके, मेजरली इस लिगामेंट की होगी बस. नाउ द नेक्स्ट क्वेश्चन इज, most vascular zone of bone is, it is also a repeat, and the most vascular zone of bone is, here are your 15 seconds. And the answer is very easy, metaphysis, because here the arterioles and the venules form the hairpin loop, and इस hairpin loop की वजह से क्या होता है, there is increased blood supply but the flow is sluggish. So इसी वजह से the metaphysis is the most common site of bone infection. Okay, and diaphysis पे you will have the nutrient artery. Here you can see this is your nutrient artery जो कि एक systemic shunt होता है, and there is a nutrient foramina जहाँ से nutrient artery enters the bone, the diaphysis or the medullary cavity. It have two branches, the ascending and the descending part, and both of which anastomosis do anastomosis with the epiphyseal and the metaphyseal arteries. Okay, now next question is, tennis elbow is characterized by, here are your 15 seconds. Okay, so very easy question, very easy question. और हमेशा टेनिस एल्बो में there are max to max 15 to 20 lines जो आपको पढ़नी होती है. ओके, सो आप सोचते अब क्या ही पूछेंगे, बट स्टिल it is a very tricky question, because lateral epicondylitis होता है तो lateral epicondyle पे होगा, this is long. Okay, and there is tendinitis lateral epicondyle पे, there is attachment of the common extensors. Okay, so flexor नहीं, अब extensor का भी you have to see कि origin है कि insertion है. Okay, very important. So याद रखना है आपको कि it is the tendinitis of common extensor origin at the lateral epicondyle. lateral epicondylitis होता है, bony injury नहीं होती है यहाँ पे. जो common extensor origin होता है, due to repeated trauma there is इंजरी और टीयर ऑफ द फाइबर्स. मतलब 100% फाइबर्स का टीयर नहीं होता, माइक्रोस्कोपिक 5 to 10% फाइबर्स गेट टीयर, जिसकी वजह से देयर इज वेरी पेन ड्यूरिंग द एक्सटेंशन ऑफ द एल्बो एट द लेटरल साइड, एट द लेटरल एपिकॉन्डाइल. सो इसके ट्रीटमेंट के लिए राइस थेरेपी तो होती है, बट देयर इज अ स्पेशल टेनिस एल्बो brace which immobilizes and gives a compressive force to these extensor tendons and they give the time to heal. Okay, and most common extensor muscle जो इसमें affect होती है, it is extensor carpi radialis brevis. Okay, extensor carpi radialis brevis, remember this thing. Okay, here is the tennis elbow brace, wear it like this. Now next question. A child presented to an orthopedic clinic with a limp. The surgeon suspected him to have a fixed flexion deformity. Okay, this is fixed flexion deformity of the hip. Which test should be the surgeon perform to confirm the finding? Here are your 15 seconds. Okay, so the answer for this test, this question is the Thomas test. थॉमस टेस्ट में आपको बेसिकली बस इतना ही याद रखना है कि फ्लेक्शन डिफॉर्मिटी ऑफ द हिप के लिए यू डू द थॉमस टेस्ट. तो हिप के लिए यू हैव 3 टेस्ट, मतलब 3 T's, and these are all are tests for the hip joint. First is your Thomas test for the flexion deformity. Second is your telescopy test in children for the femur head का mobility in CDH. and एक और चीज अपन ने अभी देखी थी, that is infancy के अंदर osteomyelitis, Tom Smith osteomyelitis. And the third is the Trendelenburg's test to check the gluteus maximus muscle. Okay, जो affected side होगा, उसका जो opposite side होगा वहां पे there will be tilt in the pelvis. Okay, so this is Trendelenburg's test. So 3 T's for the hip joint. So flexion deformity देखने के लिए you do the Thomas test. Okay, so Trendelenburg test सबसे पहले अपन देखेंगे. There the person, this is the affected side. Okay, सबसे पहले याद रखना. So this is the affected muscle, that is the gluteus muscle. So there will be drop in the pelvis, और इस तरफ झुका हुआ रहेगा कौन सा, the pelvis will be dropped on the contralateral side, but the person will lean towards the affected side. Very important, ये ध्यान रखना. Pelvis will shift towards the opposite side, but the person will lean towards the affected side, because अफेक्टेड साइड पे, ऑपोजिट साइड में पेल्विस ड्रॉप हो गया है. सो द बॉडी वेट और बॉडी का मोशन और पोस्चर को इंटैक्ट रखने के लिए द बॉडी हैज टू लीन टुवर्ड्स द अफेक्टेड साइड. ओके, वेरी इंपॉर्टेंट. इट इज योर ट्रेंडलेनबर्ग टेस्ट एंड इट वाज इन लास्ट ईयर्स. जब मैंने दिया था इन 2020, इट वाज इन दैट Jipmer examination. Okay, so now next is the, what is Nilaton's 9? Actually anterior superior iliac spine. This is your anterior superior iliac spine. Anterior superior iliac spine to ischial tuberosity पे if के बीच में if you draw a straight line, it passes near the GT. This is your GT. Okay, so this is the Nilaton's line. ओके, एंड इसका क्या इम्पोर्टेंस है? इसका इम्पोर्टेंस ये है, इफ इस लाइन के ऊपर यू फील दी head, then it is either dislocated or there is fracture neck of femur. And what is telescopy, also known as the piston test or the Dupuytren's test? इमेज में देख लो, ऐसे you try to move the head, है ना, and if it is positive then there will be excessive pistoning or excessive motion of the femur head. ओके, तो नॉर्मली इट इज नेगेटिव, ये याद रखना है, बच्चों में करते हैं. दिस इज टेलीस्कोपी टेस्ट, ऑल्सो कॉल्ड एज द पिस्टन और द Dupuytren's टेस्ट. ओके, नाउ नेक्स्ट क्वेश्चन. नेक्स्ट क्वेश्चन इज trigger finger involves which joint? Here are your 15 seconds. Yeah, 15 seconds. So the answer for this, that the trigger finger involves the very important metacarpophalangeal joint. Okay, metacarpophalangeal joint. Now what is trigger finger? Trigger finger जो होती है, जैसे ट्रिगर होता है गन के अंदर, तो जैसे ट्रिगर ऐसे अटक जाता है, वैसे ही इस फॉर्म में your उंगली, your finger, your finger gets struck like this. Okay, and it is initially, so it is possible to get the finger in position by the manipulation, but in intense cases or the chronic cases, it is not possible to manipulate the finger. This is called as the trigger finger. So इसका treatment जो होता है starting से, if you do the manipulation or the hot fermentation physiotherapy exercises, and if this does not work, you can go for the special splints or the intralesional triamcinolone acetate steroid injections. And all these, if it is not working and the condition is worsening, you have to go for the surgery where you release this fibrous sheet, because यहाँ पे क्या होता है, एक fibrous sheet होती है at the level of metacarpophalangeal joint में, and उसका there is thickening of the fibrous sheet in this disease. Okay, tendon का nodule बन जाता है due to the thickening at the ventral aspect of the metacarpophalangeal joint. This is your trigger finger. Okay, next question. True regarding Monteggia fracture is very important. Monteggia और Galeazzi बहुत important fractures है. So true regarding Monteggia fracture is very easy. Here are your 15 seconds. Okay, so the answer for this question is A, that is upper ulnar fracture and dislocated radial head. तो सबसे पहले इसको याद कैसे करना है? GRD यानी Galeazzi. So Galeazzi में you will have distal 1/3 radius fracture with dislocation of the distal radioulnar joint. And in Monteggia MUP, so you will have proximal 1/3 ulnar fracture with dislocation of the radial head. And remember, Bardo type 1 is most common, and it is an extension type where the dislocation is anterior, and the Bardo type 2 is called as the reverse Monteggia fracture dislocation. आपके काम का इतना ही है. Okay, so very important, remember this. Okay, this is your Monteggia fracture, proximal 1/3 of the ulnar fracture with dislocation of the radial head, and iska displacement are both anteriorly, so it is of extension type, that is Bardo type 1. Okay, so it is Bardo type 1. Okay, so what is the Bardo system? Bardo system is used to classify the fracture dislocation or the Monteggia fracture dislocation. Okay, now next question, very very easy question, is dinner fork deformity is seen in. Here are your 15 seconds. ओके, सो डिनर फोक डिफॉर्मिटी सीन इन, वेरी इजी. कोलीज फ्रैक्चर कैसे याद रखा है? सी के बाद डी आता है, इसलिए कोलीज फ्रैक्चर में यू विल हैव द डॉर्सल टिल्ट and the dinner fork deformity in elderly patients on outstretched hand. okay, and it is extra articular, and iska just opposite will be your Smith fracture, okay. And if the fracture is intra-articular of the distal end radius with the carpal dislocation also, so it is the Barton's fracture. And anterior volar side proga, it is volar Barton. March fracture second or third metatarsal shaft hota hai generally, and it is a stress fracture. Lateral condyle सुप्राकॉन्डाइल है, ये दोनों ह्यूमरस की अगर अपन बात करें तो supracondylar humerus will have a very common complication, late complication, malunion, cubitus, varus deformity or the gun stock deformity. And the lateral condyle fracture में आपको एक चीज याद रखनी है, that it have a very common late complication, that is tardy ulnar nerve palsy. Okay, very important. So here you can see this is your old heel march fracture. Lateral condyle, कैसे पता चला lateral condyle है? Here you can see this is your radius head. So radius head is on the lateral side. This is your lateral condyle. Dinner fork deformity you can see. Okay. Now the next question. Next question is locking of the knee involves. Here are your 15 seconds. Okay. Locking of the knee involves. Here are your 15 seconds. So the answer for this question will be D, that is internal rotation of femur with foot on ground. Now what happens, this is a natural or non-pathological condition, yeah, it is a behavior of the body that occurs in every normal individual. और इस ये क्यों होता है? Actually, if you are standing for a prolonged time, okay, if you are standing for prolonged time, so यहाँ की muscles को relax करने के लिए there is a mechanism inbuilt that is called as the locking of the knee. इसमें क्या होता है? It only occurs if you touch your foot on the ground. If your foot is on the ground and you are standing, so to uh, give rest to the muscles, okay, so what there is locking of the knee. इसमें क्या होता है? Whenever you stand, you can see कि the knee joint में the femur is fixed over the tibia with internal rotation, so that this all the especially the extensor compartment is fixed, so that जो muscles है उसको कम काम करना पड़े और there is less use of the muscles, there is rest, so that we can give rest to the muscles. So it is a physiological locking, और ये extension में ही होगी, obviously we have discussed. And the femur is internally or medially rotated, but ये फिक्स होना है तो फीमर तो चलो फिक्स हो गई, टिबिया को भी फिक्स होना पड़ेगा, फ्लोटिंग नहीं रह सकता है, तो दैट्स व्हाई योर फुट हैज टू बी ऑन ग्राउंड. व्हेन द फुट विल बी ऑन द ग्राउंड, द टिबिया विल गेट फिक्स्ड. Okay, so this mechanism allows the knee to remain in position of full extension as in standing without much muscular efforts, and is caused by the quadriceps femoris. As we all know, the extension mechanism is by the quadriceps femoris. Okay, so this is your knee locking. Now what is true knee locking? Okay, true knee locking is your pathological condition and it gets physically stuck, okay, and you need the help of the other person to disengage the knee. Okay, so the next question is positive OK sign, positive OK sign is seen in. Here are your 15 seconds. Okay, here are your 15 seconds. So AN PN क्या है? AN PN are the anterior and the posterior interosseous nerve respectively. Okay, anterior and the posterior interosseous nerves. Okay, now OK sign will be positive if your anterior interosseous nerve is intact. Okay, yeah, this is your OK sign. Okay, this is your OK sign, and in OK sign अगर ये positive है, so ये दोनों जो tip of the fingers है, they will be touched. This is your positive OK sign. But if the distal phalanges cannot be flexed, instead the volar surfaces are in contact like this. ऐसे की जगह ऐसे contact में है, like in the extension, the volar surface. Okay, this is your normal OK sign. But if anterior interosseous nerve is damaged, तो ये fingers flex नहीं हो पाएंगे, so there will be OK like this. Okay, there will be OK like this with your volar or the anterior surfaces of the fingers touching, not your tip of the finger. Okay, so it basically tests the flexor digitorum profundus and flexor pollicis longus. Okay, and these both are innervated by the median nerve. Remember, flexor digitorum profundus का जो ulnar head होता है, it is by the ulnar nerve. Okay, so it is your OK sign, also called as the circle sign, and it is positive. अगर ये OK है यानी OK है तो anterior interosseous nerve is OK. Okay, now next question. We have discussed this previously also. आज के session में the test in given image is used for. Okay, here are your 15 seconds. Here are your 15 seconds. So this is the Flachet test, the occiput wall test, and it is seen in the ankylosing spondylitis involving the cervical spine. और ankylosing spondylitis आते ही आपके दिमाग में दो चीजें आनी चाहिए, that is HLA B27 positive and bamboo spine. ओके, अदर टेस्ट जो इसके लिए यूज होते थे, दैट वाज गैंसलिन्स टेस्ट, पंप हैंडल टेस्ट, द फेबर टेस्ट. ओके, this is your Flachet test. Now the following test is performed in. Here are your 15 seconds. The following test is performed in. Here are your 15 seconds. Okay, so this is a test to test your rotator cuff, and rotator cuff में भी the subscapularis tear को टेस्ट करने के लिए होता है. तो subscapularis muscle को टेस्ट करने के लिए you have three types of test. First जो अभी इमेज में था, that is your belly press test. Okay, कि ruptured subscapularis tendon में belly press करते टाइम पे you will have pain here because there will be decreased motion of your elbow. Bear hug test and the lift off test. Okay, so ये आपको नेम याद करने हैं बेसिकली. कौन कौन से? लिफ्ट ऑफ टेस्ट, बियर हग टेस्ट, belly press test, all these are for the subscapularis muscle or the tendon. Okay, remember its name and its images, that's it. इसके अलावा आपको नहीं करना है, ज़्यादा डीप में नहीं जाना है फॉर योर नीट पीजी. और सुप्रास्पाइनेटस के लिए you have a special test which is called as the jobs test or also called as the empty can test. Okay, empty can test or the jobs test for the supraspinatus. Okay, this is your jobs test or empty can test. Subscapularis test or the lift off test is done like this. इतना डिटेल में अभी मत पढ़ो. Okay, just remember the name. Now next question. Next question is true about pathological fracture is, and here are your 15 seconds. कि वेरी वेरी इजी कि पैथोलॉजिकल फ्रैक्चर है तो ऑब्वियसली नॉर्मल बोन्स में तो होगा नहीं. सो इट इज अ फ्रैक्चर इन वीक बोन बाय अ वेरी ट्रिवियल ट्रॉमा. इट इज कॉल्ड एज द पैथोलॉजिकल फ्रैक्चर. ओके, एंड दे आर समटाइम्स हार्ड टू डायग्नोज. ओके, एंड डिफिकल्ट टू ट्रीट ऑल्सो. तो ये पैथोलॉजिकल फ्रैक्चर है. तो फर्स्ट ऑफ ऑल पैथोलॉजिकल फ्रैक्चर दिखते ही आपको सबसे पहले उसको इमोबिलाइज करना है. ओके, देन यू हैव टू डू द सीटी. एक बेसिक चीज याद रखना, बेसिक चीज ये है कि कहीं पे भी आपको बोन अनेटमी में कोई पैथोलॉजी देखनी है, इन ऑर्थोपेडिक्स की बात कर रहे हैं, ऑर्थोपेडिक्स में बोन अनेटमी में इफ यू वांट टू सी एनी पैथोलॉजी you have to go for the CT, that to the 3D CT. Like in osteomyelitis, not in osteomyelitis, उसमें तो आपको you have to see the planes also, so you see the MRI. Like in pathological fracture etc. And if you want to see the soft tissue, you have to go for the MRI, like in the knee joints, ACL, PCL, etc. Okay, so on the 3D CT, if you see a metastatic bone disease, then you have to first identify the primary and you have to go for the treatment. Okay, now if you have a primary bone tumor, okay, of the bone only, so you have to diagnose it कि benign है कि metastatic है. benign है so उसका treatment, metastatic है यानी sarcomatous है तो there is two grades, high grade और low grade. low grade में wide resection with uh, grafting or reconstruction, or if it is high grade you have to do the amputation or wide resection with chemotherapy. Okay, now next question. Most, sorry, the outermost covering of peripheral nerve is, here are your 15 seconds. So the outermost covering of the peripheral nerve is, it is your epineurium. Here you can see in the diagram, this is your एपिन्यूरियम. सबसे पहले नर्व शीट या एक्सोन को कनेक्ट कवर करती है एंडोन्यूरियम, एंड बहुत सारे एंडोन्यूरियम से एक फेसिकुलाई बन जाते हैं विच इज कवर्ड बाय द पेरिन्यूरियम. हियर यू कैन सी, एंड बहुत सारे पेरिन्यूरियम या फेसिकुलाई मिलके एक नर्व बंडल या नर्व शीट बना देते हैं विच इज कवर्ड बाय एपिन्यूरियम. सो एंटायर नर्व एपिन्यूरियम, fascicles, perineurium, and the individual axons, the endoneurium. Okay, now very easy but very important question. Sudden classification is used for the here are your 15 seconds. Sudden's classification is used for So the answer for this question is both A and B. ये तो सबको ही पता है कि nerve injury के लिए use the Seddon's classification, but POTS paraplegia is also a type of nerve injury. So इसमें भी आप Seddon classification use कर सकते हो. Okay, because POTS spine में there is pathology of the spine, there is tuberculosis of the spine, but उस fragment के collapse होने की वजह से या dislocate होने की वजह से there is injury to the nerves. So there is also nerve injury. So ढंग से question पढ़ना है, जल्दबाजी नहीं करनी है. Okay, now ड्यूरिंग माई स्टडी डेज मेरे को सडन क्लासिफिकेशन और एक और क्लासिफिकेशन में कंफ्यूजन होता था, दैट वाज सॉल्टर हैरिस. तो याद रखना, सडन क्लासिफिकेशन इज फॉर नर्व एंड सॉल्टर हैरिस इज फॉर द एपीफाइजियल इंजरी. अब याद कैसे करोगे, नर्व इंजरी में एन आ रहा है. ओके, इन नर्व इंजरी यू हैव एन, एंड सॉल्टर हैरिस में कहीं पे भी एन नहीं है, but in Seddon's classification you have n here. Okay, so n से n yani Seddon will be for the nerve injuries. Okay, remember it like this. So the answer for this question will be both A and B, that is nerve injury and sorry again sorry. So the answer will be both A and B, that is your nerve injury and the POTS paraplegia. Okay, तो Seddon classification में you know कि there is 3 types of nerve injuries. First neuropraxia, then axonotmesis, then neurotmesis. तो neuropraxia में क्या होगा, neuropraxia में there is no injury to the nerve proper. Okay, so spontaneous 100% recovery is possible. Okay, there is injury to only the axons and spontaneous recovery is possible but not 100%, and it takes time. And neurotmesis mein entire neuron or the nerve sheet is destructed, so it will not have any spontaneous recovery. You have to go for the surgery and it has a very poor prognosis. Okay, which the neurotmesis. Okay, so neuropraxia is the grade 1 where there is only focal segmental demyelination. Spontaneous recovery will occur. In nerve conduction study you will have only a partial block, and electromyography will be normal. But in axonotmesis it is of grade 2, 3 and 4 where there will be damaged axons with or without damage to the endoneurium. तो damaged axon है, axon के साथ में endoneurium भी damaged है, and in grade 5 axon के साथ में endoneurium and perineurium all 3 are damaged, यानी fasciculi level तक इंजरी हो गई है. That is your axonotmesis. और दूसरा क्लासिफिकेशन जो अपन पढ़ रहे हैं ग्रेडिंग का, दिस इज सुंदरलैंड क्लासिफिकेशन. तो याद रखो यहाँ पे भी एन आ रहा है. सो एक्सॉन सेडन क्लासिफिकेशन के बेस पे 3 है, न्यूरोप्रैक्सिया, एक्सोनोटोमेसिस एंड न्यूरोटोमेसिस. सुंदरलैंड क्लासिफिकेशन में 5 ग्रेड है, जिसमें से 2, 3 एंड 4 ग्रेड सिर्फ एक्सोनोटोमेसिस की बना दी है सुंदरलाल ने. और वो क्यों बनाई है, जस्ट कि एक्सॉन हुआ है, एक्सॉन के साथ में एंडोन्यूरियम भी हुआ है क्या, और इन दोनों के साथ में पेरिन्यूरियम भी हुआ है क्या. ओके, and neurotmesis is the grade 5 of the Sunderland, that is the complete nerve transaction with myelin sheet, axon, endoneurium, perineurium and even the epineurium. ओके, सो स्पॉन्टेनियस रिकवरी कभी नहीं होगी, कंप्लीट ब्लॉक होगा. इलेक्ट्रोमायोग्राफी विल बी एबनॉर्मल इन बोथ एक्सोनोटोमेसिस एंड न्यूरोटोमेसिस. ओके, तो सेडन क्लासिफिकेशन और सुंदरलैंड क्लासिफिकेशन फॉर द नर्व इंजरीज. ओके, सो व्हाट इज स्पॉट्स डिजीज. स्पॉट्स डिजीज इज योर टीबी स्पाइन, ऐसे याद रखना है. और देयर विल बी डिफॉर्मिटी ऑफ काइफोसिस. ओके, ये याद रखना. सो POTS paraplegia मोस्ट सीरियस कॉम्प्लिकेशन ऑफ स्पाइनल टीबी इट्स ऑब्वियसली पॉट्स पैराप्लेजिया 20% होता है, एंड मोस्ट कॉमनली इट अकर्स इन द डोर्सल स्पाइन. ओके, मोस्ट कॉमनली इट अकर्स इन द डोर्सल स्पाइन. नाउ, और ये ध्यान रखना स्पाइन फ्रैक्चर के लिए, बी इट ट्रॉमेटिक स्पाइन फ्रैक्चर और ड्यू टू द टीबी स्पाइन, ऑपरेटिव इंडिकेशन उसका है या नहीं है, उसके लिए वी use a classification or a grading system which is called as the Tully's classification. Okay, बस आपको इतना ही याद रखना है, that is the Tully's classification. Okay, this is a Pott's spine. Here you can see collapse leading to the Pott's paraplegia. Okay, so this was about today's question answer session, the MCQ session, marathon session. Okay, I hope you liked it. प्रैक्टिस हुई होगी, आपको पता चला होगा कौन सी चीजें इंपॉर्टेंट है ऑर्थोपेडिक्स के अंदर. ओके, सो रीड क्वेश्चंस केयरफुली, रीड फर्स्टली क्वेश्चन को रीड करना है, देन इमेज को देखनी है, देन ऑप्शन रीड करना है, उसके बाद आंसर को टिक करना है. क्वेश्चन समझ नहीं आए या कंफ्यूजन हो, छोड़ना तो कोई भी क्वेश्चन नहीं है, ये ध्यान रखना. 200 में से 190 क्वेश्चंस अटेम्प्ट करने हैं. कंफ्यूजन हो या समझ नहीं आए, रिव्यू, मार्क इट फॉर रिव्यू फॉर लेटर, डोंट वेस्ट टाइम. ओके, सो tomorrow at 4 September, on 4 September I will be so it was आज का, सॉरी 4 सितंबर आज का है. ओके, सो वी हैव डन दिस पार्ट. नाउ टुमारो ऑन 5th Sunday at 4 PM I will be starting my revision of orthopedics. So पूरी orthopedics NEET PG के लिए अपन 2 days में cover कर लेंगे around in 7 hours. So first session of my marathon revision will be tomorrow at 4 PM on YouTube live, and it's continue 6 को, that is on Monday. I will be having the part 2 of the marathon rapid session or as a special class on Monday 7 PM. So special class please attend करना. यहाँ पे मैं आपको एक्स्ट्रा चीज़ें, एक्स्ट्रा एज हमेशा देता हूँ, स्पेशली नीट पीजी के लिए. जस्ट डाउनलोड द ऐप and subscribe using this code, both of which are absolutely free. Okay, so I hope you like today's video. Like, share and subscribe करिए अगर आपको पसंद आए, और अगर मैं और भी ज़्यादा पसंद आता हूँ तो मेरा ये कोड यूज़ करके सब्सक्राइब करो अनअकैडमी पे. एंड नॉट ओनली फॉर द नीट पीजी, फॉर नीट यूजी, यूपीएससी, कैट, बोर्ड एग्जामिनेशन, जो एग्जाम का आप नाम लोगे अनअकैडमी सब पढ़ाता है, और ये मेरा कोड भी सब पे अप्लाई होता है. ओके, सो स्टे सेफ. लास्ट 7 डेज बचे हैं, अच्छे से सोना है, अच्छे से खाना है, पॉजिटिव रहना है. सबके दिमाग में ये बात रहनी चाहिए, सिर्फ 7 दिन बचा है, 7 दिन का संघर्ष है, देन आई विल बी फ्री, आई कैन डू एनीथिंग, टेंशन चली जाएगी. एंड प्लीज प्लीज लास्ट 7 डेज है, डोंट टेक स्ट्रेस, एंड अपनी हेल्थ का ध्यान रखो. सर्दी, जुकाम, खांसी, बुखार से बचो. ओके, बाय, सी यू टुमारो, ऑल द बेस्ट.